Welcome, ladies and gentlemen, boys and girls, dogs and cats, elephants and zebras, gypsies and fairies. Sorry, I'm looking at the screen and not the camera. I'm sorry, hold on. And so, welcome, people. This is not going to be a pleasant video. I'm sorry I'm interrupting my beautiful girlfriend in there, but I'm like, not as mad as I was last night, but I'm still upset about this. I don't know if you can, guess you can't see. And I think between Lisa and myself, I got all the little sticky things off of my body. I put them on my legs, on my chest, on my arms. So anyway, I had been having some chest pain for a few days, and I'm just like, I just didn't want to have to go to the hospital because I don't like the experience. Okay. Anyway, I'm looking at something that just popped up. Anyway, when you have, or when you might have had a heart attack, you have to stay in the emergency room for a long time because they take blood work, they do an EKG, and they have to wait a certain amount of time, do more blood work, another EKG, and so forth and so on. And hon, do you remember what time I went up there? 6, 7 o'clock? So about 7 o'clock last night, I drove to Keene and went to the emergency center there, and then, excuse me, and then I said I'm going to give it till 10 o'clock. Actually, what happened before that is, I'm getting frustrated. I'm like, do something, tell me something, whatever. I'm like, when's the doctor going to be here? Oh, 8 o'clock. Oh, when's the doctor going to be here? Oh, 9 o'clock. The doctor's here. The doctor's in the room next door. An hour later, the doctor's still in the room next door. So, I'm like, look, I've been here all night. I'm tired. I'm frustrated. I want to know what's going on, and you're not telling me anything. You're not doing anything. You just keep me in this freaking room by myself with a TV, and I'm not that much of a TV person. And I'm laying there. I can't get up and do anything. Here I can get up and clean. I can get up and cook. I can get up and do something. When you're in the emergency center, you're just, well, not sitting there, but laying there. I tried to be polite, and I think for the most part I was. But 7 p.m. to after 10 o'clock a.m., that's more than 12 hours. With all honesty, they had more than enough time to take care of things, and they didn't. So I told the nurse, I said, look, take this IV out of my arm, please. I'm leaving. And she took it out. She did an awful job of taping it onto my arm. It was coming off last night. As soon as she put it on, it was popping off. And you flex your muscles or something, and it tightens up, and the tape kind of comes off. But she said, okay, well, she said the doctor's in the room next door. And I didn't say anything, but I'm like, you told me an hour ago the doctor was in the room next door. So does it really take that long? Does he have to be in that room with that patient for a whole hour? Usually the way things work, the doctor goes in the room, they order some tests, they tell the nurse and the techs to do things, and then they go see another patient, and they wait till results come back, then they go back and see the patient that the results came back on. Where was he? I don't believe them. I think they were lying to me that the doctor was in the room next door. Why would he have been in that room for a whole hour? I don't think that, I mean, it's possible, but not probable. And I'm like, I told myself I'm going to give it till 10 o'clock. I gave it till 10 o'clock. I'm going to give it till 10:10. And there were 3 clocks. Each had a different time on it. There was about a minute difference. So I waited until the slowest of the 3 clocks hit 10:10. I told the nurse, take this out of me. I'm leaving. As she went to get somebody to discharge me, I just walked out the door. I never signed a paper. I just left. I was pissed off. I'm like, you're supposed to be medical professionals taking care of patients. It's, you go to work into the emergency center, into the hospital every day. You're used to it. That's your job. That's what you do. That's what you know. Before a patient doesn't go there every day. Okay, it can be frustrating. It can be a waste of time. I think last night was a waste of time. Well, they said I wasn't having a heart attack at that moment. So, actually what they said was all my my EKGs and blood work came back negative. So that's good. They could have told me that earlier, but whatever. But when you need to communicate with your patients, you need to not just answer questions with a short, simple sentence. You need to actually talk to your patients. That's an almond I just put in my mouth. Oh, I need to save that. Anyway, I have had heart attacks, so it's something I think about. And I have absolutely no desire to go back to the emergency center at Cheshire Medical Center in Keene, New Hampshire. And I have no desire to do that. My wife passed away in that hospital. We were together, so it really weighs on me when I go in there. And then the whole needle thing. I have this thing about needles. Okay? But I think about Texas, Florida, Oklahoma. When they kill somebody, they put a needle in their arm. And they pump them with drugs. And, so I have that image in my head. And, I just, if I can help it, I'm not going back to the emergency department at Cheshire Medical Center in Cheshire and in Keene, New Hampshire. I'm not going to do it. I like my doctor. She's a good doctor. She's a great doctor. But the people people in the emergency department, you're accustomed to all that goes on. Patients are not. Okay? So I'm not going back. I'm just, if I can help it, I'm not going back to that stupid emergency center. There is another hospital. It's a little further away, but it is in this area, and that's where I would prefer to go. I don't know how well they would treat me, but at least I would have the chance to find out. You never know until you go. Although I didn't like how they treated my wife, nor at least one of the doctors. But anyway,